Hey there guys, welcome back or welcome if you're joining for the first time. It is part 2 on the video of drug-drug interactions. Okay, so now let's look at the idiosyncratic effects. Now this is an unpredictable effect that occurs during a drug reaction and it doesn't follow normal pharmacology and it occurs largely due to patient-specific reasons. Now there are many things that can lead to drug-drug interaction. For example, herbal medicines, foodstuff, and the environment, self-medication, new therapeutic agents with a known downstream potential, polypharmacy, and severe comorbidities. Let's start by taking a look at polypharmacy. On polypharmacy, it is simply that the more drugs you take, the more likely you are to have an adverse drug reaction. And as such, there's an exponential rise in mortality rates and a significantly extended average hospital stay. Now, this polypharmacy tend to happen because of what we call the prescribing cascade, where someone who's already taking maybe two or three drugs has an adverse drug reaction. He goes to the doctor. The doctor thinks that adverse drug reaction is a new disease, give the patient another drug to cure the disease, and as such, there is more adverse reaction. Patient goes to another doctor, they'll give him another drug. So you see the patient go to different doctors and getting more and more drugs, and increasing the number of drugs he's taking, then increasing the chances of polypharmacy. Sorry, adverse drug reaction due to polypharmacy. Now, people with hepatic or renal impairment are in great risk for drug-drug interaction because these are the organs of elimination of drugs, but they are impaired, so they can't fully work. As a result, high risk. Another group of people who are at risk are transplant patients and people on long-term therapy for chronic disease. For transplant patients, they rely on a complex, precisely balanced, life-sustaining immunosuppression regimen. Any drug interaction that induces or inhibits this pathway risk immediate organ rejection or fatal toxicity. But for people with long-term therapy for chronic disease, there's just an increased chance of having a drug-drug interaction. Now, drugs that tend to cause drug-drug interaction tend to have some red flags. These are a narrow therapeutic window, a steep dose response curve, they are either a known enzyme inducer or inhibitor, and they have saturable mechanisms. So, in summary, drug interactions are not only bad all the time, it can be beneficial, which doctors tend to take use of, or it could be trivial, seeing it in lab testing of the drug, but not really having a huge effect in humans, or it could be adverse, and sometimes these adverse reactions could lead to death.